Hello and welcome to YouTube channel Health Q, the place where our mission is to motivate you and help you to move on to the brighter side of the health. In today's video, let's talk about pediatric hemiplegia. Well, what exactly is pediatric hemiplegia? What exactly happens to the brain while a child suffers from pediatric hemiplegia? What are their signs and symptoms and how it is managed? We are going to cover all of these things in today's video, so make sure to watch this video till the end. Let's begin. Friends, I am physiotherapist Meghna Dave, founder and chief physiotherapist at HealthQ Rehab. Well, coming from a neuro-rehabilitation background, we get a lot of patients, a lot of kids who suffer from pediatric developmental disorders. And one such pediatric developmental disorder is pediatric hemiplegia or hemiplegia seen in child. Now, if we look at the literal meaning of hemiplegia, hemi means half or partial or one side, and plegia means paralysis. So, when the paralysis is present on one side of the body, it would be called as hemiplegia. Sometimes it's also synonymously used with the term called as hemiparesis, which means partial weakness on one side of the body. Well, whenever this kind of condition happens, there is a damage to the opposite side of the brain, which means if the paralysis is seen on the right side of the body, the damage is on the left side of the brain and vice versa. The severity of this condition will vary depending on child to child and depending on the level of injury that has happened to the brain. Some of the common signs and symptoms that a child will show who suffer from hemiplegia would be: first, preference of using of one side of the body compared to other, which means child will prefer using the normal side over the other side. Also, you will see a very significant difference in the ability of doing activities on the affected side and on the non-affected side. Apart from that, the affected side hand will most of the time will be fisted. Yes, children who have got hemiplegia will be keeping their hand fisted, rotated internally and bent in this way throughout the day until unless they are forced to open the hand and do some activities with that hand. The other common sign of hemiplegia is delayed walking. Children with hemiplegia usually show delay in their ability to walk. Similarly, they also show delay in ability to stand independently. Children with hemiplegia usually have difficulty in walking and difficulty in balance, and that's why they trip off or fall very easily. Also, the children with hemiplegia tend to walk on their toes on the affected side with the knee slightly bent and the foot is in drooped or dropped position. Spasticity and tightness on the affected side is also one of the predominant symptoms when a person or else a child suffers from hemiplegia. Spasticity levels can vary, but most of the time spasticity is definitely present. Apart from that, some kids will also show facial droop on the affected side, slurred speech on the affected side, weakness of the face on the affected side, and they also feel numbness on the affected side. So these are some of the typical signs that a child with hemiplegia shows. Now, along with this, there could be some coexisting condition that could be present for a child suffering from hemiplegia. These conditions could be seizures, cognitive difficulties, speech and language issues, sensory deficits, behavior and psychological problem as well. So now the next problem or the next concern that you need to understand is what causes this hemiplegia. Well, there are multiple causes for hemiplegia, but usually these causes are brain damage during birth, before birth or after birth, brain malformations, injury to the brain following a fall, or else brain damage following infections in the brain. If a child has brain tumor, that also could lead to presence of hemiplegia. Infection and brain bleeding are some other causes to mention. In older children, stroke, brain tumor, fall due to road traffic accident or some other reason, brain infections are the leading cause for hemiplegia on one side. So now how does this hemiplegia is being diagnosed? Well, diagnosis of hemiplegia depends on first history. Doctor will take a proper history of the child along with clinical examination. This clinical examination involves observation, physical testing and incorporating some sort of diagnostic test and procedures like CT scan, MRI, blood test, etc. This all gives the findings which would be suggestive of stroke or else hemiplegia, and the doctor will come to the conclusion. Now, the next thing that comes is treatment. So, treatment of hemiplegia basically comprises of therapy and medical management and sometimes surgical management. Therapies usually comprise of physiotherapy, occupational therapy, speech therapy, and other allied health therapies as well. In rehabilitation, the idea is to focus on two goals. One is the short-term goal and second is the long-term goal. Short-term goals basically focuses on overcoming short-term challenges, which could be including of short-term symptoms like pain, difficulty in speech, numbness, etc. And the long-term goals basically focuses on functional independence. Depending on these goals, physiotherapist comes up with an exercise plan which basically focuses on three things. Number one is muscle relaxation or tone management. Number two, postural control or improving the postural alignment of the child. And number three is physiological and neurological development of these muscles so that movements become more easy and more better. This is also called as functional training or neurodevelopmental therapy, where on a progressive manner exercises are suggested to the child so that the child can grow on a consistent level. This forms an overall management of pediatric hemiplegia. So this forms an entire overview about pediatric hemiplegia. I hope you found this information helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.